Maybe you're recovering from it all this morning. Either way, thank you for spending part of it with us. It is so good to be here with you. Okay, here's a question. Were you in the sun and are you waking up a little sunburned this morning? Perhaps a lot sunburned. Well, look who's here. Dermatologist Dr. Kristen Richards on how to handle that burn. Oh, I've been there. And it doesn't feel good.
No, it doesn't.
Okay, so what are some easy things people can do today if you're waking up and your skin is on fire? What do you do, doctor?
There are a lot of old wives' tales out there, a lot of home remedies. So you might hear about aloe vera gel.
Yes.
That's one of them. That might decrease the inflammation in your skin a little bit.
Okay.
A little bit of milk.
I've heard
people
that.
talk about putting milk on your skin to help with the sunburn and the peeling.
Does it work?
It really doesn't work that well.
Okay, so skip the milk.
Right. What we want to do for a sunburn is decrease the inflammatory response in the skin.
Okay.
So at the first sign of a sunburn, what I usually have my patients do is take 800 milligrams of ibuprofen.
Really?
It cuts down the inflammatory response and the pain of a sunburn right away.
Okay.
The next thing you want to do is put a high potency steroid cream on your skin. And that will immediately take down the redness and, interestingly, prevent the damage that can occur later.
Interesting, okay.
If you have a blistering sunburn and you're in a lot of pain, you obviously need to seek some medical care. But what we can do is give patients the steroid dose pack to really take down all that blistering and that pain.
Okay, now these ones, how do they work? If you need to get your hands on them, do you need a doctor to prescribe this to you? Can you go to the store and pick it up?
Right, obviously Advil, ibuprofen, any of those medications are over the counter. You can pick that up anywhere. You can get some over-the-counter steroid cream as well. I prefer the high-potency stuff because you're going to get a quicker reaction.
But this one you would need to go to a doctor to get.
You would definitely need to see a dermatologist for that.
All right. What do I see at the end of the table? What is that?
So these are different sunscreens. And you know, it's really interesting. A lot of people don't know what to look for in a sunscreen. So there are three things you want to pay attention to. The SPF factor. The American Academy of Dermatology recommends an SPF greater than 30. Whether or not your sunscreen is water resistant. So people think, oh, I've got an SPF 100 on, I'm gonna spend the entire day out in the ocean, getting wet, sweating, and I'll be fine. Well, that's the problem. Most sunscreens only cover from 40 to 80 minutes. So you gotta check your sunscreen and make sure you know how long you're covered.
Can I ask a total odd question? Why wouldn't they just make a sunscreen that is just what you're supposed to be? Well, why make it so complicated with the water resistant and the SPF and this and that?
Well, the thing is, if you're really planning to be at the beach, you want water resistance.
Okay.
So you want a thick sunscreen that's going to last. It's not going to be real cosmetically appealing.
I see. Okay.
So for everyday wear, you want to wear something a little bit more elegant. Doesn't necessarily have to have the water resistance factor in there, but it'll give you really great protection.
Okay, so then maybe you're saying is maybe if you got that sunburn and you still got burned using the sunscreen, you're using the wrong sunscreen.
Yes, you got to pay attention to those factors, the SPF, whether it's water resistant, and whether it's broad spectrum, UVA and UVB coverage.
Okay, final question. If you're sunburned today, it's the summertime, people want to keep going out, how long would you tell our friends to stay out of the sun?
Definitely, if you've gotten a sunburn, you got to wait till that sunburn is healed.
Okay.
Use the proper medications to speed up the healing.
Okay.
And I would wait for a good week before going back out into the sun. Hopefully next time with your broad-rimmed hat and all your sunscreen.
You got it? Wait a week, and next time, lather it up. Put it on more. Dr. Richards, thank you for being here.
Thank
we
you.
appreciate it.
Thank you.
Okay, we'll send it over to you.